200 DTS exams were performed in the last 2 years. The majority examination in our department are shoulder and wrist, before and after osteosynthesis, as well as general fractures, for example, hip and spine. I want to show you is fracture of the humeral head. In normal X-rays, it's sometimes very difficult to see in how many pieces the head is broken. So here the DTS can show you nicely how many pieces the head is broken. This is just a fracture with the tuberculum majus and humeral head, and there is no splitted humeral head. This is really important for planning the osteosynthesis. So you know this patient, this is after done the osteosynthesis. Here it is also difficult to see if the screws are in the correct position, and the DTS is very helpful to see if the screws get in all pieces of this fracture. And you see here this osteosynthesis is done very well. This lateral view of the thoracic spine. You see there's a fracture, but how old is the fracture? On the right side you can compare the CT scans done after the DTS. So on the lateral view there's a fracture, you see it over there, but how old is the fracture? We do a DTS scan. You see nicely the margin of the vertebral bodies. The blades, there's a compression fracture, and it looks with a little bit of compression here near the blade. The superacute fracture with the same information like in the CT scans, and it's not necessary in some cases to do a CT scan after DTS of the spine. You see on the right side X-ray of the pelvis, you see the left hip, there's an osteoarthritis, but it looks a little bit not so normal, this osteoarthritis, so we do at first the DTS of the hip, and you see we come from the back. We go through the trochanter major. You see there's no space in the joint, and you see maybe there are little bubbles over there. And we do a CT scan after it, and you see air in the bone. This is an inflammatory osteoarthritis, which go through the femur downwards and also to the acetabulum. Nicely seen here. According to our experience in the last 2 years, I am convinced of the image quality because of the good contrast and detail in all layers. Artifacts leading to diagnostical failure are really unusual. Consider performing an additional DTS. The main advantage is completing the examination without repositioning the patient. We are able to gain more detailed information with reasonably low dose.